program started just over 3 years ago. The community was saying that they wanted more recreation, particularly for the children, more activities.
Together that physical inactivity was really identified as a high priority.
And I think the reason we came up with swimming was we were trying to find something that people could do outside program time. So it was okay if we were running swim programs, people would come. And we'd spoken to the YMCA, and at that stage Koori weren't using the YMCA facilities at all. There was probably about 3 people they could name that were using the facilities.
Yeah, it was just good for families to get in and swim and enjoy themselves, and then they got onto this, started up the Swim Bubs program, and you could see how much these children have developed from the program.
They really enjoy it. They're happy. They learn and know how to swim a bit more.
It helped with our children out at the trust to, it was more of a social thing as well, getting them to mix in with local kids within here. You know, even if we was to be somewhere and to know that one of these children fell in the water, you know, they'd probably be able to keep themselves afloat until, you know, enough time for an adult to see whatever happened.
Huh? Jen, do you want to come with us?
Unfortunately, with most programs, numbers seems to be a measure of success.
Yeah.
But getting the Koori community feeling comfortable about using a facility like the YMCA was quite a task. I mean, there's a lot of barriers to people going there. The obvious ones, like, you know, cost and transport and things like that are a barrier to people going. Women saying that they couldn't swim themselves, so they weren't feeling very comfortable about taking their children to a facility where they felt they couldn't save their child if they, were in difficulty. Getting into bathers was another big barrier to going swimming. Lake Tyers Aboriginal Trust is about a 20-minute drive from town, and there's no public transport. Also, our public housing is up the top of quite a steep hill, so if you've got a few children. So we knew about those, but I think it was just the environment. People were saying, we don't go there, we don't feel comfortable going there. And that's actually why we started with a family swim program. So we invited the whole community to come swimming. And to our great surprise, we had about 100 people show up, and that consistently happened over 3 or 4 sessions. The unfortunate thing was we didn't have funding to fund those sessions because they were so large.
Yes. And
transport, as soon as you hire a coach, there's $300. The Bubs Swim Program came out of that. So talking to women at the swim program, they were saying, this is great, we've got lots of teenagers in the pool and lots of primary school kids, but we want something for our little kids, and that's where the Bubs program started.
Well, it depends how much you got left over to your groceries and your bills and all that too.
Last year sometime brought the girls on one hot day, and it cost us close to about 20 something in the 30s. Yeah, but they had fun, yeah. He was swimming with the babies, yeah. They're more confident in swimming. Like if we take them to the lake down here or the beach, yeah, they'd be more confident in going in.
He's been taught a lot of life skills and water skills, safety skills, and it's just wonderful. Now when I do take him out into the lake, I now can trust him to go into the lake and swim.
Water safety, their survival skills for life. In 3 years, they have come from being very, very tentative. They're very confident. They can do correct strokes. They can do tread water. They can survive for themselves out there in the pool. It's just brilliant to see what they're up to now.
So we've kind of brought a whole range of people together to work on the program, which is great because we need to find a way to work more effectively in the community and to find out what the community needs, and the only way to do that is to build a relationship where you can actually have honest conversation.
Certainly as a flow-on from the Koori Bubs Swim Program and the development of the Koori Kinder Gym, we are seeing a far larger number of Koori clients accessing on a one-to-one basis our allied health services, but part of the real success that I see as an allied health professional is the Koori Kinder Gym kids getting access to speech pathology that they weren't before. They have a physiotherapy assessment if it's required. We've got occupational therapy input for the kids, and that's all great. But we're also having access to the parents, and we can have conversation with the mums and talk about different coping mechanisms or things that they can employ at home to help with the kids. So that that's That's a real bonus to us. We see on a Friday now the Koori Kinder Gym and the Koori Elders group, you know, they're working together, they're virtually sharing morning teas, and for us as allied health professionals and for Gippsland Lakes community health in a whole, that's a real bonus.
Go For Your Life has funded the Lakes Entrance part of this program, but also we've recently just secured funding for the next few years for Koori Kinder Gyms. That's through Vic Health. We've now got 3 swim programs running a week. We probably average, you know, 15 to 20 children in each program, trying to get these children, we'll offer the opportunity for these children to exercise on a regular basis, and there's a lot of evidence around if we can get these children exercising at that early stage, even if they go away from it, the evidence says they'll come back to it later. Yes. So those first few years are really, really important. Every week we've probably got anything between, I suppose, 45 to 60 children under 5 swimming. In Beansdale, they're very, very well supported by parents, so you'd have a parent or a teenager in the water for every child that's in the water. Here in Lakes, we run a slightly different model because the childcare come in, so they come in with workers. And look, I think the partnerships, the friendships, the relationships that have come out of it, like people from the community ringing you about other things, like you start to become a link for people to get information about other things. You know, over the summer holidays, we had our first session at the beach, supported by the Surf Life Saving Club. So they come along and supported our swim day. I believe they haven't got any Kooris in the club at the moment, so we're hoping that, you know, just through the process of kids coming through the swim programs, that they'll be interested in perhaps becoming nippers and come through that, you know, that's what people want to do. From our point of view, it was about getting people more active. We knew to expand the program we'd have to develop partnerships. Kilmany Communities for Children have been a big supporter of the program, have picked up some of the funding, but more than that, they've actually committed workers and support for the program and allowed that network to expand through their networks as well. So it's almost like a little, you know, it's a web, it just keeps growing and growing. Just starting to say, you know, things like hearing testing is getting picked up earlier. So we've had several children where problems have been detected. So I guess then for them starting school, the child starting school hearing properly, which has been a big problem in the Koori community. Had workers say there's been less colds, we're seeing less snotty noses, and through that child coming swimming and coming to kinder gym, a lot of that stuff's been addressed and a lot of the problems they're having has been picked up.
He fell over and broke his collarbone, and then he started doing the swimming, like to move it around. He's improved heaps, like the doctor even said. But yeah, he was very unstable on his feet and stuff, like clumsy, and yeah, now that he's doing the kinder gym and stuff like that, he's a lot more stable on his feet. Well, I reckon.
Their speech has improved, their hearing, they all passed their hearing test this time. Just everything is improved, and it's just the best day out. You can really see the difference in like families, the ones who didn't start off swimming.
Happy little bunch.
Yeah, they all look forward to coming in.
They just enjoy swimming. They love it. Love mixing with other children.
It wasn't the reason we started this program, but it's certainly when we started looking at the evidence around swimming, it was certainly a stat that needs to be addressed. Indigenous children are 3 times more likely to die from drowning than non-Indigenous children.